SAPHNELO, anifrolumab-fnia injection for intravenous use, blocks the activity of type 1 interferon, or IFN1, a central mediator in SLE pathophysiology. Systemic lupus erythematosus, or SLE, is a heterogeneous disease that has a complex pathophysiology. While previously seen primarily as a B-cell-driven disease, evolving scientific understanding has identified the cytokine type 1 interferon, or IFN1, as a central mediator in both the innate and adaptive immune systems. Evidence suggests that dysregulation within these two systems contributes to inflammation and tissue injury in SLE. SAPHNELO is the first and only SLE treatment to block IFN1 activity. SAPHNELO is indicated for the treatment of adult patients with moderate to severe systemic lupus erythematosus, SLE, who are receiving standard therapy. The efficacy of SAPHNELO has not been evaluated in patients with severe active lupus nephritis or severe active central nervous system lupus. Use is not recommended in these situations. SAPHNELO binds to subunit 1 of the IFN1 receptor with high specificity and affinity. This binding leads to the internalization of IFNAR1, thereby reducing the levels of the cell surface subunit 1 available for assembly. The internalization of IFNAR1 prevents the binding and signaling of type 1 IFNs. Thus, it blocks plasma cell differentiation and normalizes peripheral T-cell subsets. By blocking the biologic activity of IFN1, a central mediator across both the innate and adaptive immune systems, SAPHNELO inhibits IFN-responsive gene expression, as well as downstream inflammatory and immunological processes, thereby having an important role in the pathogenesis of SLE. Important safety information. Contraindication. SAPHNELO is contraindicated in patients with a known history of anaphylaxis. Warnings and precautions. Serious infections. Serious and sometimes fatal infections have occurred in patients receiving immunosuppressive agents, including SAPHNELO. SAPHNELO increases the risk of respiratory infections and herpes zoster. Use caution in patients with severe or chronic infections. Avoid initiating treatment during an active infection, and consider interrupting therapy in patients who develop a new infection during treatment. Hypersensitivity reaction, including anaphylaxis. Serious hypersensitivity reactions, including anaphylaxis, have been reported following SAPHNELO administration. Events of angioedema have also been reported. Other hypersensitivity reactions and infusion-related reactions have occurred following administration of SAPHNELO. SAPHNELO should be administered by healthcare providers prepared to manage hypersensitivity reactions, including anaphylaxis and infusion-related reactions if they occur. Immediately interrupt administration and initiate appropriate therapy if a serious infusion-related or hypersensitivity reaction, for example, anaphylaxis, occurs. Malignancy. There is an increased risk of malignancies with the use of immunosuppressants. The impact of SAPHNELO on the potential development of malignancies is not known. Immunization. Avoid the use of live or live-attenuated vaccines in patients treated with SAPHNELO. Use with biologic therapies. SAPHNELO is not recommended for use in combination with other biologic therapies, including B-cell targeted therapies. Adverse reactions. The most common adverse reactions, incidence greater than or equal to 5%, are nasopharyngitis, upper respiratory tract infections, bronchitis, infusion-related reactions, herpes zoster, and cough. In the controlled clinical trials, the incidence of infusion-related reactions was 9.4% in patients while on treatment with SAPHNELO and 7.1% in patients on placebo. Infusion-related reactions were mild to moderate in intensity. The most common symptoms were headache, nausea, vomiting, fatigue, and dizziness. Use in specific populations. Pregnancy. A pregnancy exposure registry monitors pregnancy outcomes in women exposed to SAPHNELO during pregnancy. For more information about the registry, or to report a pregnancy while on SAPHNELO, contact AstraZeneca at 1-877-693-9268. There are insufficient data on the use of SAPHNELO in pregnant women to establish whether there is drug-associated risk for major birth defects or miscarriage. Advise female patients to inform their healthcare provider if they intend to become pregnant during therapy, suspect they are pregnant, or become pregnant while receiving SAPHNELO. Lactation. No data are available regarding the presence of SAPHNELO in human milk, the effects on the breastfed child, or the effects on milk production. Pediatric use. The safety and efficacy of SAPHNELO in pediatric patients less than 18 years of age has not been established. Please see full prescribing information, including patient information, at www.saphnelo.com/HCP.